I'm a physician and medical director, John Brazzell. The basis of addiction disorders is a brain disorder just like any other disease. We believe that medication such as buprenorphine or trade name of Suboxone is very helpful. It is a type of opiate medication, so a lot of people don't really understand the mechanism of action of Suboxone, and they feel like it's just a substitution of one opiate for another. I believe that is not the case. I believe that this is a unique drug. It is not a full agonist like a lot of other opiates. It's very highly regulated, and we're very careful about the prescribing of the medicine. We try to tailor the dose to the individual patient. We don't want the patient to feel high or low. We want to try to relieve their cravings, try to make them feel comfortable, and try to change their thinking to recovery thinking rather than addictive thinking. The very first phone call that we received, we try to make patients feel at ease. We try to talk to them a little bit about their history, and then we have them come in and see our licensed clinical social worker. After she interviews the patient and gets a more thorough history, I do the initial assessment, and then we do what's called an induction with medication on the first day. We establish a dose for them. It's always more frequent follow-up in the beginning after the induction, and then eventually they just come once a month if everything's stable. Somewhere around a year, if I think they're ready, I'll start talking to them about tapering, but I never force anyone to taper the medication because there's an extremely high risk of relapse when you do that. I mean, it just changes their whole life. I see people getting their families back. I see people getting their jobs back. I see people making their house payments again. People building better relationships. It's something where I feel like I'm really making a difference in their lives.